Hello, my name is Martin Dawes. I'm the Chief Scientific Officer for Genexus Healthcare Systems, and I'm just going to go through how I use TreatGx. I'm just going to use one case, and it's a example case, and it'll have a patient who's post myocardial infarction, just to demonstrate the various features that we've now integrated into the new version. Basically, there are three main areas that I'm interested in when I'm using this software. Which conditions the patient has, so I can actually add any of these conditions. I can add medications here for those conditions. The main tool is identifying the medication options for an individual patient. So here is my example patient, typical patient with comorbidity with diabetes, hyperlipidemia, high blood pressure, migraines, osteoarthritis. And what I'm interested in is this patient on the right therapy for their post myocardial infarction? They've just come out of hospital, they're seeing me in primary care maybe 2 weeks later. So here is the medical history. They've got diabetes, they're age 56, they're 70. They've had a STEMI, and the intervention's been medical therapy only. The genetics has already been pre-populated. Potassium is normal. They've got slightly reduced renal function and slightly impaired liver function. Now they're already on hydrochlorothiazide, citalopram, Imitrex for the migraine, metformin and ibuprofen. But basically, if I'm happy with this information, I press the button at the bottom. The system then will look through everything for the management of the patient with post-myocardial infarction, and not surprisingly, the first thing you see at the top here is that they're going to be given 5 drugs. ARB or ACE, dual antiplatelet therapy, beta blocker, statin, and nitroglycerin as needed. So the first thing you can see here is that there's a genetic symbol indicating that this patient is at increased risk of experiencing an ACE inhibitor-induced cough due to that genetic variant. If we go down to captopril here, you can see that captopril, the dose has been adjusted already for renal function, but not only that, the system tells you that this was based on the product monograph and that the adjusted target dose has not been studied for secondary cardiovascular prevention. If we move down here, we can see that ramipril has actually had the dose adjusted for hepatic function because impaired liver function does affect the metabolism of ramipril. Again here, the target dose has not been studied for the secondary prevention in this population with the dose reduction for hepatic function. This part, it's warning me that if we're using dual antiplatelet therapy in the presence of SSRIs, non-steroidals, or anticoagulants or steroids, we're increasing the risk of bleeding for this individual patient. Next part down, Plavix clopidogrel is not included as an option because of the CYP2C19 status. I don't even have to know what the genetic variants are. The system is already giving me the information so that I've got to use ticagrelor, and it would be quite common to see a patient come out of hospital with Plavix or clopidogrel and actually be one of the 30% of us who do not metabolize that drug effectively. As I continue going down now to the beta blockers, we can see here that metoprolol is not included as an option due to a metabolism affected by the genetic variant CYP2D6. And there are some warnings here, interactions. So if you want to see what these are, you click the plus button and it will say, okay, the serum concentration of sumatriptan for the migraines can be increased when it's combined with carvedilol. For all the interactions, one can actually use this feature to understand more about that interaction. In the statins, as we go further down, we can see that this patient may have a greater LDL reduction with rosuvastatin based on their genetic phenotype. So you can see that, I've chosen a complex case with multiple medications, but you can see how much information is being provided, not only pharmacogenetic information, but information about the management of patients with renal impairment or decreased liver function. And I'm just going to show you here if this patient had percutaneous intervention without a stent. So it's now telling us that the evidence is that these two drugs have evidence of increased effectiveness versus Plavix or clopidogrel based on post-MI clinical trials in patients with STEMI and PCI. So the information informing this is coming from international guidelines and has been curated for these algorithms. So I think that's enough for one session. I'll be doing more of these, looking at more of the individual diseases and more of the functionality of the program. And if you've got any questions, please contact us at info@genexus.com. Thank you.